Logo, Prevention Planning into Action. Prevention Planning Roundtable. Advice and lessons learned in prevention planning.
Welcome to Advice and Lessons Learned in Prevention Planning, an excerpt from the Prevention Planning Roundtable discussion with child welfare leaders. I'm Sarah Vidrine from the Capacity Building Center for States. In this excerpt, participants share their advice for other states and what they wish they had known before engaging in prevention planning. If you had just one sentence that you would say, I wish I knew this before I started down this path, what would you say?
Susan Lindberg, LICSW, Associate Director of Community Services and Behavioral Health, Rhode Island Department of Children, Youth, and Families.
Project how long it's going to take and double it.
Deborah Shropshire, MD, MPH, Director of Child Welfare Services, Oklahoma Human Services.
Don't sort of be offended by small beginnings. I think it's okay to start kind of where you are, and then with the anticipation that this really is a thriving, growing process, not a static one.
Stephen Grilly, ACSW, Director of Child Welfare Programs, Washington State Department of Children, Youth, and Families.
And you could have spoken for me, Deb, because I was in that same kind of space around, I wish I'd known initially, in some ways, how complex this is to pull off. There are so many things that you have to do, from IT to policy to everything across the board in the work that we do. And as Deb was noting, just be kind to yourself in terms of expectations and how long this may take, because you have to walk it forward a little bit at a time. We had, and still do, we laid out some fairly grand plans in our prevention plan around lots of candidacy groups and lots of EBPs, and we intend to deliver on that, but we won't do it in a year, and it's gonna take. We're also encountering along the way, of course, as in any project, delays that are unanticipated, like COVID, and some overburden on our IT system and things like this that really knock the project sideways a little bit. And so just knowing ahead of time to expect those things and to be okay with that.
Jennifer Thornhill, MSSW, CSW, Prevention Branch Manager, Kentucky Department for Community-Based Services.
I think just the same, managing expectations and then being able to celebrate that incremental change.
Stephen.
I was just going to circle back to the beginning and encourage states to really think big and stake out that vision. I can't emphasize that enough, because I think it does set your direction and kind of hold you there. And to the extent that you can really think about this as, again, broader than just family first, what do you really want to accomplish for families in your state, for all of them? Even if it's aspirational at this point, how are you going to get there incrementally? But at least lay out that big picture, and don't be hesitant to do that.
Deborah.
I'm curious if the rest of you have perspective on where you kind of stole shamelessly from, whether it was other states or whether it was organizations. Some of the organizations mentioned, like Casey Family Programs or Capacity Building Center, that brought a lot of groups together. But I would say with that, we certainly did. And I would say with that, we need to keep doing that. Not only do we need to keep doing that, but I think collectively as jurisdictions, we need to beat on the drum of what we need to continue to do this work. And so in a sense, we need our federal partners, as well as even locally our partners, to understand like what the needs are to actually accomplish that big vision.
Krista Bell, MSW, Executive Advisor, Kentucky Department for Community-Based Services.
I agree as well. Even though Kentucky was an early implementer, we have really viewed our plan as a living document. As Stephen said, it is, we have a larger vision of where we want to go. And our original submission was the first baby step in that, longer journey. And so, we have looked at those, plans that were submitted after ours, and we have learned a lot of great things from other states and opportunities, provided by The Casey forums have been very helpful to us as we think about how we get to where we want to go in terms of, building sort of a family and community well-being system, rather than a child welfare system. So I agree completely. The more that we can learn from other jurisdictions, and I agree with you too, Deb, and really be clear about what is needed to get there. So if there are ways that that Children's Bureau can be helpful or national advocates can be helpful, really clearly communicating that, I think that helps us all get there collectively.
I'll just emphasize both what Deb and Krista have offered. It's the extent that states can plug into those national forums and conversations. We do that routinely to hear what other jurisdictions are working on and how they're doing that. There's even a group now meeting to talk about how to get, in some ways, beyond family first and work on that really community delivered supports, and how we can set that up outside of the child welfare system so that folks don't have to come into it to get what they need, which is ultimately where we want to go. So it's great to have thinking partners across the country to do that with, and to the extent jurisdictions can get involved, it's really helpful.
Sarah.
Now that you've had an opportunity to listen to tips and lessons learned from these state leaders, consider bringing your team together to discuss how the information shared might influence your prevention planning process.
Visit the Capacity Building Center for States website for more information about available resources and to find your jurisdiction's tailored services liaison who can help support your capacity building needs. Website, capacity.childwelfare.gov/states. Logos for the Prevention Planning into Action series, the Center for States, and the Children's Bureau. Prevention Planning Roundtable. This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families Children's Bureau, under contract number HHSP 2332-0150-0071I.
The opinions expressed do not necessarily reflect the views and policies of the Children's Bureau.